So in this next video, we're going to talk a little bit more about HRT itself, the different kind of formulations that it comes in and how to take it. We're not going to focus on additional benefits or the risks of HRT because we'll talk about that in a separate video. So do have a look at that if you are interested. So hormone replacement therapy is certainly the first line and also the most effective way of treating menopausal symptoms for those that are able to take it. It acts to replace the estrogen levels that drop during menopause, resulting in so many of the symptoms that those going through it may experience. So we've talked about this lock and key theory before. So estrogen is a hormone which acts like a key in a lock of the estrogen receptors, which are present throughout our whole body and help with the functioning of each of these areas. We explored this in much more detail in some of our other videos on why menopause happens. So when these levels fall, symptoms can be really widespread and will affect everyone slightly differently. Although a lack of estrogen is what is causing the symptoms, HRT consists of other hormones which can make the whole thing slightly confusing, and we'll try and clear that up now. So the estrogen part of HRT is the therapeutic part, and it's seeking to replace what you're missing. We'll talk about the different types in just a minute. But the other hormone, progesterone, is also a really important part of HRT. And although it doesn't do anything for your actual symptoms of menopause, it is something all women with a uterus will need to take as well. So estrogen, when given on its own, will increase the chance of the lining of the uterus growing and increases the risk of developing cancer of the womb. What the progesterone does is it protects that lining from becoming thickened, and so it is essential to take this if you are taking estrogen. The exception to this rule is in women who have had a hysterectomy and therefore don't have a uterus that needs protecting, and they can just take estrogen only HRT. The estrogen part comes in a variety of different forms, either as an oral medication in a tablet or absorbed through the skin in transdermal patches or gels or sprays. And in some specialist units, they offer estrogen implants which sit under the skin, but this is much less common. Some people prefer the convenience of a tablet, and historically this is what was used before transdermal forms came about. They are also combined with the progesterone, so there's only one medication to take each day, which is much more convenient. Oral forms, however, may not be appropriate if you have certain additional risk factors for a blood clot in your leg, which is known as a deep vein thrombosis or a DVT, or in your lung, a pulmonary embolus or a PE. So if you're over 60, that risk does increase, and we wouldn't recommend that you have oral HRT if you are over 60, because it does pose a slightly higher risk for developing these conditions. So you may have heard the term bioidentical hormones used. What this simply means is that the molecular structure of the hormone is identical to the estrogen that we naturally produce before menopause. The transdermal estrogens are all bioidentical, and they're derived from soy or yams. The choice of the route of transdermal forms is completely a personal one, and it's not really that one is better than another, it's just what fits your life better. So patches are normally changed twice weekly, so this can be a really good option if you struggle to remember to do something daily or just feel too busy. They also come with the benefit of having a combined form in one of the normal doses of the estrogen. So estrogen and progesterone in one patch for certain doses, meaning that only one medication to administer, similar to the tablets. A gel or a spray has the benefit of not being visible once applied, which may be a factor for you, but it's something that needs to be used on a daily basis, and you should ensure the formulation has absorbed into the skin and it's dry before you're putting on your clothes, which can take about 5 to 10 minutes. So all of these forms should be applied on clean, dry skin, and once it's applied you can shower and swim and get them wet, but you have to wait for 2 hours after application to do that. The progesterone part of the HRT can be delivered in a number of ways. As I've already mentioned, some of the estrogen patches and the tablets are combined with progesterone for convenience. Another option is a progesterone tablet called Utrogestan. This can be a really good option if you have used progesterone contraceptive in the past, or you suffer from PMS symptoms in the second half of your cycle and are particularly sensitive to progesterone. Due to the way it's formulated, it tends to have less side effects and is another formulation to be considered as bioidentical. It also can help with sleep when you take it in the evening. A third alternative is a hormonal coil, and now if you're still having periods and require contraception, it can be quite a good option as it serves to provide both functions of progesterone and contraception. It can also be a really good option if your periods have become much heavier, as by thinning the lining of the womb, it makes periods much lighter and often stops them completely. It also eliminates the need to remember another medication because it's there and it lasts for 5 years. So testosterone is another part of HRT which is unlicensed in the UK but can be used in those who experience low libido, which does not improve with HRT on its own. So we have a separate video in discussing this option in a lot more detail. Finally, vaginal estrogen in the form of a cream or a pessary or a ring can be used for those who are suffering from urogenital symptoms that we talked about before, such as dryness, pain on intercourse, or recurrent urinary infections. It's a much lower dose of estrogen than in systemic HRT, and so it can be safely used for those who have had breast cancer and can't take other forms of HRT. Do have a look at our other video which we talk about a lot of the risks that are associated with HRT, which can be helpful in informing your decisions.